Hello dear students, welcome to the video lecture series on general methods for the treatment of poisoning. Myself Dr. J.P. Lavande, Associate Professor, Department of Pharmaceutics, Shulingeshwar College of Pharmacy, Almala, Taluka Ausa, District, Latur. Already we had started the general methods for the treatment of poisoning, in which we had covered the introduction and the signs and symptoms. Today we will discuss the diagnosis aspects associated with poisoning. So, consideration of poisoning in patients with altered consciousness or unexplained symptoms that would consist of history from all available sources, the selective and the directed testings associated based on the nature of poison. The first step of diagnosis of poisoning is to assess the overall status of the patient. Severe poisoning may require rapid intervention to treat airway compromise or pulmonary cardio collapse. Poisoning may be known at presentation. It should be suspected if patients have unexplained symptoms, especially altered consciousness, which can range from agitation to somnolence to coma. If purposeful self-poisoning occurs in adults, multiple substances should be suspected. History is often the most valuable tool because many patients, for example, pre-verbal children, suicidal or psychiatric adults, patients with altered consciousness, they cannot provide reliable information. So, friends, relatives, and rescue personnel should be questioned for the same. Even seemingly reliable patients may incorrectly report the amount or time of ingestion. When possible, the patient's living quarters should be inspected for clues, for example, partially empty fill containers, a suicide note, and evidence of recreational drug use. Pharmacy and medical records may provide useful information. In potential workplace poisonings, co-workers and supervisors should be questioned. All industrial chemicals must have a material safety data sheet, that is MSDS, readily available at the workplace if such products are used there. The material safety data sheet provides detailed information about toxicity and any specific treatment if available. In many parts of the world, information about household and industrial chemicals can be obtained from poison control centers. Consultation with these centers is encouraged because ingredients, first aid measures, and antidotes printed on product containers are occasionally inaccurate or outdated. Also, the containers may have been replaced or the package may have been tampered with. Poison control centers may be able to help identify unknown pills based on their appearance. The centers have ready access to toxicologists. The telephone number of the nearest center is often listed with other emergency numbers in the front of the local telephone book. Physical examination sometimes detects signs suggesting particular types of substances, breath odor, presence of topical drugs, needle marks, or tracks suggesting injected drug use, stigmata of chronical alcohol use. Even if a patient is known to be poisoned, altered consciousness may be due to causes. For example, central nervous system infection, head trauma, hypoglycemia, stroke, hepatic encephalopathy, Wernicke's encephalopathy, which should also be considered. Attempted suicide must always be considered in older children, adolescents, and adults who have ingested a drug. Also, children often share found pills and substances. Careful inquiry to identify additional potentially poisoned patients among playmates and siblings should be undertaken. So dear students, thank you for watching. If you like this video, please hit the like button, share our videos to your friends and subscribe to our YouTube channel Dr. JPL Video Lectures by pressing the red color subscribe button to get notification about more such videos. Thank you.